little bit about the cases that I did today, which are really, really great. And just overall this week, I do a lot with anti-aging, a lot with scars, a lot with acne, and pigmentation. So I'm going to wait for a few moments for more people to join us right now. But for those who don't know me, I am Dr. Qazi, and I actually love to really just stay hyper-focused on a few things so I could really excel at them. I think that it's really best to actually do it that way instead of really just being a jack of all trades. So I'm going to kind of talk a little bit about that as well tonight, just about just what makes me different in the world of aesthetics, and why I think that in order to be really excellent at something, you really need to understand the subject really well and just really be focused on it. There's still so many different things within this subject that I still try to learn about, and I still learn about even just talking and interacting with you guys. I think anybody in this world actually could see that there's a lot of things that are happening all the time, and things shift constantly. And so it's really arrogant to really assume that you know everything, and it's okay, really. So part of what I do is just sort of investigate and see different things. Even if I may sort of suspect that, I know the subject, a lot of times I still want to investigate just to double check to make sure that I'm really accurate with what I'm saying. And that just tends to be my approach in life in general. And I think that it's really, really great to be that way, to just sort of have like more of like an egoless type approach where you don't really just think that, you are above everybody else. I do think that I have, quite a bit of knowledge and quite a certain skill set that works incredibly well for what I do. But that being said, there's always room to grow. So that's partly what I do here. And so I also, if you guys have other things that you want me to talk about or learn about, feel free to ask me, and I'll take a look and see either during the live or afterwards, just specifically what it is. So we'll take a look and see that. What do I know about subcision? So I do a ton of subcision. This patient ended up doing subcision as well as excision. So that's a result right over here for that. But subcision is something I do a ton of. What particular questions do you have about subcision? Because I could try to more be focused on the questions that you have about that and what we do it for. Kay is saying, Doctor, can a patient do XLV and Pico in the same session, assuming they need both? Yes, you can. I think it's Amy saying, Dr. Qazi, I would trust you. Could you let me know if you have any office in Virginia? No, I really am only over here in Orange County, California. The reason why is just because my team is over here, and I just want to make sure that everything's smooth. Everything's very, very safe for patients. We do things really, really well every single time, every single day. We have multiple patients. We have people coming from all over the world for this. And I love it. I love the fact that we have people from all over the place. And so I prefer really just for people to come to me so we could do it really properly. And on top of it, just pay attention though that, I am really close to the airport. So we have patients flying in all the time from out of state. More than 60% of our patients are out of state. We have a lot of patients also from Northern California as well. So people come back and forth like that too. So it works really, really well. Let's see here. I know I'm seeing questions here. So what's better, microchanneling or microneedling? Well, what are you trying to solve? That's what I guess that's what matters there. G saying, great result. I love when the skin tone is more even after the treatment as well. Yeah, absolutely. So I work a lot with pigmentation too. So I really try to maximize the patient's pigmentation while we're doing things, because I do think also, even though I'm doing the scars, I do think that pigmentation is just a problem for a lot of patients in general. And then on top of it, sometimes the pigmentation actually makes the scars look worse. I have a patient that came in today, and they're a few months out after the scar session, and the skin looks incredible, even under really harsh lighting. It's still really good, but they're noticing still the red marks that are on the skin, and that's that can last for several months actually sometimes. And a lot of times that's new skin, but also these little broken capillaries that can sometimes get stuck there. So it could take some work, but at least as long as you're wearing sunblock, it's not going to turn hyperpigmented, and that's a lot easier to manage that redness there. Let's see here. Swaggy P saying, I was prescribed doxycycline and it gave me an intense headache. That could potentially happen. It's unlikely though, but if that is the case, are you, by the way, on anything else, like any other medications or anything like that you may be that potentially could cause that. That's kind of what matters on what we could take a look at seeing. Which page is saying, what about injecting sculpture into scars? I do that as well. I don't mind doing that. But sometimes it depends on how significant the scarring is. If it's really a lot of volume loss, then yes, it makes sense. But individual scars, not as much, because sometimes it doesn't go exactly where you want it to go. With sculpture, it is a little bit more dilute of a product. It's certainly more dilute than something like Radiesse even, and then certainly more dilute than Belafil. Belafil is not dilute. So Belafil is really, really precise as we're doing that though. But, it's a possibility there. So I just want you to pay attention to that. And then, let's see here. I know, what are your thoughts on subcision causing sagging in the face? Really good question. I haven't had that issue because I'm, as I do it, I'm very precise with it. I also tend not to do deep talar liberator in the lower part of the face. So I usually don't do that. So I usually don't do it that way. I usually just do basically just along the cheekbone where I break up that scar tissue, but I actually don't typically use much of the talar liberator at all in this lower part of the face where I think you do run into a lot more problems there. That being said though, I do think that there is a possibility. That's why I've always avoided certain areas when I do it, and I really don't cross the nasal labial fold, for example, too. I try to be really, really careful as I'm doing. I'm never really just going with like a windshield wiper approach with a blade in the skin. So as I'm doing, I'm typically doing a blunt cannula, and then for certain areas, particularly for this patient, for example, where it's really stuck, then I may do a talar liberator just for that area. But I usually don't do it for like the full area of the face, and that works out really well for people. I know I missed a few questions here. Let's see here. What did I miss here? What are your thoughts on subcision? Oh, I know I got that one here. Please read comments one by one. I am doing that actually, but there's a lot of comments, so I actually have a lot of different places. I'll try to get to them. Just please feel free to just ask me again, and I'll be able to help you out with that. Jessica Hernandez is saying, do you offer training on TCA cross? Yes, I do. It's just a matter of timing for me. I had a lot of requests, and just this year has been so busy, so it's really tough for me to do training. I just really selected just a few people just to do training. I see the messages though, so we'll try to reach out back to you soon when we could try to open that up. But maybe some point next year or something like that, I'll try to do some more trainings there. But I'll see what we could do there for that. Let's see here. Microneedling or CO2 laser for scars? Absolutely laser more than microneedling. Let's see here. Harris is saying, your prices for acne scar treatments went through, you blew up on TikTok, 7,000, 8,000, justify please. Well, first of all, I don't think that we changed much of our pricing at all. Really, even though the economy is terrible, everything's gone up. And the people that give us products, they've all gone up in price. But our prices have been pretty stable, actually. Most people in general for us have typically paid about $5,000 to $7,000 for their scar treatments. And I do excellent work under a single combination session, better than anybody else that I could possibly have ever seen anyone do. I'm just saying that, like, just as I'm not saying that just like to say it. I'm just like, that's how it is. And my prices are much lower than other people that think of themselves as scar experts in this area, really. And I wanted to make it as accessible as possible, but still there's a lot of time involved in there, a lot of effort that's involved with what I do. I try to do this in an exceptional way. There's a lot of follow-up stuff that we have to do. There's a lot of staff that's involved with it. There's a lot that's involved with us to do this consistently at a very, very high level. I don't know anybody who shows as much results as I do night in, night out. We show so many results, so much process, so much of this over and over and over again. Consistently, we showcase with a clear lighting. We showcase how much improvement we're getting over and over and over again, and nobody else does that. So that being said, though, that I am aware of the cost for a lot of patients. So we do have a lot of different treatment payment plans, and then on top of it, just so you know, we also do future scar sessions for, let's say, if you do the combination session and in the future you need more TCA cross, which almost always you're going to need a little bit more TCA cross for deep ice pick scars. This patient, when he came in for this photo, we did more TCA cross, and we did some Belafil for him as well. But that what I mean to say is that is going to be up to 55% off. So like the laser part of that and the TCA cross part of that. Nobody else does that. No one does it. I mean, I just know that I hit it like these kind of results, single session, amazing result after a single session, and I'm capable of doing that, and I'm going to continue to do that to make sure it just gets such a high level every single time. And so that's why I make sure that, when I'm doing this, I'm not like counting on patients coming back and forth. So many of our patients are out of state. So I want this to be as easy of a process as possible for you guys. So that way we really knock it out of the park for you. I don't know anybody else that's going to be able to offer that kind of level. Plus, right now, by the way, this month is double the points with us. You guys know, I don't know if maybe you guys don't know because some of you guys are new, but if you go to our page, you'll see that we have a point system, and you basically get dollars per treatment. So you could use that towards other treatments then actually. So essentially, if you're spending a lot of money for acne scar sessions, you could do that you could use some of those points towards other treatments then, just so you know. So there's other little things that we do just to help out patients. And I've tried to make sure that it's as reasonable as possible, but really for someone like myself, like with the way I do things, I just don't know of anybody who does it as consistently as this, and does a system where after you do the combination session, after you've invested so much money, we're going to be doing up to 55% off for additional treatments like laser and TCA cross. There's nobody else that does that. And just because I'm so comfortable and confident in knowing that I'm just going to maximize your results under a single session, that's why I do that. So I think that personally, the prices are really reasonable for the amount of work that I put into it. I do a lot of work every single time, and I love doing it. I do also I make sure that I don't do too much though when I'm doing it. I also make sure that I just do 3 scar cases every day. I don't want to do much more than that because I want to make sure that I'm hitting this really, really well, and I'm really like every single time getting results like that. And I do. So it's really fun. I'm actually going to reverse the image here. I'm going to try to get it so that you guys could see the image below me. Take a look at this. This is going to be cool. Watch this now. There we go. How's that? Better? I think that's better, actually. Okay, cool. I like that. Any ideas or help about melasma? Yeah, I do a lot with melasma, a ton with melasma. So mostly I do pico laser, but if you're at home, I'd always tell people try Eucerin's anti-pigment cream. It works really well. It's going to be slow, but try that, and a lot of sunblock. So try that. That's a good starting point for you. Let's see here. David saying, can you get a cure laser treatment just to treat oily skin and not acne? Yeah, I showed a result just yesterday of somebody just with oily skin. His acne was under control. It worked out incredibly well for his oil production. So I would absolutely help you out with that. I know I missed a bunch of things here. So SL Princess saying, what is recommended wait time in between getting Botox and a laser treatment? Usually I end up doing it about 2 weeks before, or I should say 2 weeks after the laser treatment. But otherwise we could do Botox before at some point. It doesn't make a difference. Let it settle in, that's fine. But it's not really going to run into too many problems there. How many more treatments do I think this guy needs? This patient, I do think that it's probably going to need 2 or 3 more sessions. Probably not much more of laser. This laser, we smooth down those scars really well, but most likely TCA and Bellafill. So 2-3 sessions of that. I haven't seen him since I saw him last a few months ago. He's due for coming in for more TCA and Bellafill. So we'll see how it goes and just how his collagen response is. That's kind of what I'll tell and determine with that. Audrey saying, if you do subcision on the lower half near the jawline, do you recommend a cannula? Yes, that's correct. I usually only use a cannula there. Dame is saying, I just did my first session of cool laser. If I don't like the results, I'm coming to you. Well, it depends on what's happening with your scars and what you're trying to treat for the cool laser. I don't think it's going to help too much with scars. Audrey's saying, a lot of people speak highly of me on acne scars subreddit. I appreciate you. Thank you guys so much. Let's see here. By the way, I've always saw this before, that I honestly, the community, just in general, not just for the scar community, but just the community, the patients that I have on social media, things like that, very, very supportive. I love it. Really, it's just really cool. I love the fact that everybody is just so supportive, and people are consistently, helping each other out and answering questions, things like that on here. Really nice, actually. So I love that little aspect there. Not Jay is saying, why do people say you could get acne from greasy foods? I eat greasy foods and don't break out. Well, most of all, it's genetic anyways. But there is a component where certain food, especially something like dairy products, for example, chocolate, nuts, those could all potentially trigger acne. And yeah, fast food could definitely trigger it as well, probably due to the hormones though. Nicole saying, hi, what's your favorite type of laser for acne scars for skin types 4? So it's not about the laser at all. Like this patient, yes, I used the laser, but it was about the breaking up the scar tissue with subcision, doing excision, literally taking out the scar. Those are things that matter. Doing TCA cross, those things mattered a lot. So that's what ended up helping out with there. Let's see here. I know I missed out a bunch of stuff here. Sonia saying, besides surgical neck lift, can anything be done about sagging neck skin? Yeah, you could do neck tight. You could do that. Let's see. Joey saying, can you put yourself on top of the results at the bottom of the screen? That's funny, Joey, that said that, because I actually did that without even realizing you said that. I love it. So we're on the same page there. Let's see here. I know I missed so many things. If I did miss it, please ask again, because I'll try to answer it there. Miriam saying, I paid $700 for a food dye test for my acne. Was I scammed? I don't know. You know, there's a book. I talked to you guys about that before. Dr. Leslie Bochman. Take a look at it. Call it the Acne Diet Book. I actually think that there could be an update now at some point. And I'm actually working on that with some of the patients. I keep on asking them and trying to and jot down everything about the things that are triggering their acne. But she has a very good book for the time. About the acne diet. Basically, it talks about what causes acne scars, or acne, I should say. So think about that. Just take a look and see if that's something that you could consider. You know, and if you need to shift your diet due to you know, you tried everything else, and this is something that like it was potentially causing more oil production there. Tanya is saying, is Morpheus 8 good for treating acne scars? No, not so much. It's okay for skin tightening, of the skin tightening portion of things, because sometimes there's loose skin with acne scars, but not so much for the scars itself. Danny's asking, how do you treat raised acne scars on the face or body? Really good question, Danny. A lot of times, actually, I will use a laser to just zap that and burn it down. And then we could use a little bit of steroid basically through the laser channel holes. That could work well. Or you could just do a little bit of steroid injections. It just sort of it depends on what's happening. Is it a keloid? Is it a hypertrophic scar? What exactly is happening? If it's a keloid, I usually don't do like that approach where I just burn it down. Then I'll usually just use steroid injections and more like vascular lasers, really. Is this after one session? Yeah, this is one session at this point, although he came in now, you know, this day, and we ended up doing more TCA cross and more Bellafull for him that day, which I imagine is going to be a lot better now at some point. What's a downtime for acne scar session? I'm in school and just want to know how long I need to recover. Most people need about 4 to 7 days. Most people, 4 to 7 days. Cal Ray is saying, does subcision using cannula cause new small indents? Not quite, no. I mean, it depends on your insertion points. You know, typically I'm inserting really close to the hairline, not really causing any problems. I haven't found any patient with new scars at all from everything I've done. Even when I do talar liberators, for example, I don't run into that problem. It's sort of the way you enter, you know, and essentially making sure that you're doing it in the right layers and making sure that it's as small of an opening as possible. You really will close that really nice. Nicole saying, I love TCA cross. It really helped my ice pick scars. Yes, it's awesome for ice pick scars. You know, I had a patient consulted today. I'm not sure if they're on tonight, but she says she sees my lives, and basically she was saying that she went to a dermatologist, and the dermatologist actually seemed like they did a great job. I was telling her that she otherwise did a great job, but the concern that the patient has is that she has a lot of superficial scars, that some of them may have gotten a little bit worse, and she said that basically the TCA percentage was consistently in all the scars was 80%, and you really are going to run into problems that way. And so what I do is I really vary my concentration of the TCA depending on the depth of each particular scar, and I really just go through it and just see, this is the percentage of this one, this is the percentage of this one, this is the percentage of this one, and that's how I map it out. And I'm really precise with it. Really, when we do the consultation, I already have a very good game plan of how I'm going to do this. And to be honest with you, I see a lot of patients, but I have a really great memory when it comes to just like memorizing skin and just memorizing like how it feels and looks and things like that. And I can see that whole journey. A lot of patients are really surprised by that because, you know, I'll remember that they had a scar at this place or that place, and I'll say that the scar is gone that you used to have right there. And they're like, how did you remember that? And it's like, you know, I can't remember like a textbook of like just like a bunch of text, like a block of text. And it's kind of funny to me because all my life I thought, man, it's going to be tough for me to go into medicine because I can't just like, I don't know if I can understand the science stuff. because it was just like a bunch of block of text. And it turns out that that's not actually real medicine. It's actually like understanding it is really with pathology and understanding the patients, understanding when patients are in front of you and like looking at it this way and like kind of really figuring out step by step each individual problem of the patient. And then you could actually end up getting, the really a high level and making sure that you really could not only diagnose, but then also, of course, treat the actual problem really well. So there's a lot of people that memorize really well, but they actually, when it comes to practical things, like in clinical terms, they actually can't really do real proper medicine sometimes. And sometimes that's why I tell people, a lot of patients come to me and they say, I ask a lot of patients because they're younger. Some of my patients are acne and things like that. And they'll say, that they wanted to do medicine, but they did like a general chemistry class or organic chemistry class and did a lab with it and all this stuff. And they feel like they can't go into medicine because they have a hard time memorizing stuff or a hard time with these science things. And I have to remind them that that's not actual real medicine, honestly. That's not real medicine. It's like a lot of medicine is just like logical and working on things and problem solving. And if you're able to do that, you could actually do medicine. Problem solving is a really big thing. So it's like, just try to learn how to do that. And if you have that skill set, and sometimes when I'm talking to patients, I could tell that like they've done a lot of investigation themselves. They're really intelligent. Otherwise, they're working through the problems and they're seeing through. That's like medicine right there. Like you should not be like stopping yourself from going into this field or going to other fields potentially just because you couldn't like memorize things on a paragraph. Like that's not what like everybody has different forms of intelligence, and everybody has like brilliance in them, really, I think. And just sometimes it just gets stunted because of the system, the school, their parents, other things, or other outside external factors that are there. They just didn't have the access to certain things, and so it's really unfortunate that they just feel like they couldn't achieve like their highest level because of that. So sometimes, when you're sitting on the table, I will remind you just like to try to shoot for that. Just do it, because like it's okay. If you can't memorize stuff, it's going to take you a lot more work. You're going to have to put a lot more hours in there. Sometimes when I was in med school, I was working double, triple the amount of work compared to the people next to me sometimes, because it's just like I wanted to just like get through this, and like I drew everything out. I was doing it all because that's how I remember things. I remember things by like drawing it out and like visually and doing it with my hands. So this, give it a shot. Even if you feel like you can't remember things, you actually ultimately can still do things. Don't feel limited by that. School sucks, honestly. School system is garbage. So don't worry about that. Danny's saying, second question, why is there so much fear mongering around Belafil? Honestly, if the people are worried about it, the physicians or the nurses or the PAs that are worried about injecting it, they shouldn't do it. It's true. Because your technique may not be the right technique for Belafil. Belafil requires a certain way of doing it. And I've talked about this multiple times before. It's not a product that you push in there and in the traditional way. I do so much dissolving every single day of my practice of people all over the area, across the country really, because I use ultrasound. And so I see so many mishaps with filler. And the way people do filler, it's like this epidemic that they were doing in the early 2020, 2021. Even before that, honestly, but there was a whole push for cannula, and everybody was doing cannula filler over here, and they're shoving so much filler, and then people are just have this like abnormal smile now, and it's really alienized. And so you're not going to like doing Belafil because you won't be able to reverse it afterwards. So do it properly, do it really well, and then you won't run into those problems. But if you're looking at it like a product that you're just going to shove in there and then hope for the best, or sort of, I've had people say that don't worry so much. You could always massage it out, or if you do filler or something like that, or you could dissolve it. I never think like that. I'm never thinking, I'm just going to push this in there and hope for the best. I'm just trying to get this so that this is excellent every single time. Very different mindset. So if the mindset is that, like going into that, then don't do that. Bo Kimming saying, how many sessions of this picture? This is just one session right here over here for this patient. Agent Spy saying, if you do TCA and laser the same day, is the recovery still 4 to 7 days? Yeah, typically about 4 days then probably for that. Chico saying, I did TCA and ice pick scars and I got white spot. What's the reason? Well, sometimes there's sometimes a little bit of sun exposure can cause a small little bit of leukoderma, just localized. So that potentially what ended up happening. But a lot of times it does wake up. It usually isn't going to be a more permanent type of condition. Audrey saying, I saw that Dr. H in London says blunt cannula subcision is ineffective. I disagree. I do a lot of what I do with blunt cannula. Yes, I do blades in certain areas. If someone was asking about this, I was trying to get back to it actually, about Noker needle versus talar liberator. Noker needle is what I do more superficial. Talar liberator is much more, is typically intradermal. So that's typically what I ended up doing. So I ended up If I need to, if things are stuck after I check out one area with the blunt cannula, I'll go in there potentially with a small localized spot and do a talar liberator. Or I may do like a small localized spot with the Noker needle. But I don't do this this windshield wiper approach when I'm using blades with like the talar liberator that's deep. So I don't do that way. So blunt cannula can be, most of what I do is with blunt cannula. Most of what I do is with that. So there you go. And Pruja saying, as an RM with aesthetic experience, what's the best way to transition to derm? Is challenging. Well, what are you trying to do? What are you trying to solve with that, though? I think that's the question, I guess, is. Let's see. Cal Ray saying, thank you for coming to see you from Malaysia. How early should I be making an appointment? We'll try to make it now. This is our busiest time right now, so we'll be happy to help you out. But, we'll see when we could do it. Do you know Dr. Davin Lim from Australia? Yeah, he's great. Love what he's done for the field of acne scars. Blue saying, do a lot of your patients do a cure before acne scar treatment? Many do. Yeah, many do. Actually, I believe this patient did as well. This patient actually did do it, actually. I remember, actually, I should have mentioned that. So this patient also did a cure, and then we also ended up, you can see his jawline a little bit more here. We actually did do liposuction in his neck as well, just so you know. I forgot to mention it. Sometimes I do a few different things, and so I'm like focused on one aspect of it. But yes, we did do, in this case, a cure. But I just want to control your acne. I want to control your oil production. So we could do things like either isotretinoin, we could do spironolactone, or we could do the cure laser. Really, if you don't want oral medications, things like that, the cure laser works really well. So that'll hopefully help it for the long term. But that being said, a lot of times what we want to do is just control your acne. That's the biggest thing. I want to just make sure that your acne is under control when we do that. Let's see here. Coming next week for my master's, nervous for drooping. It shouldn't really happen, Regina Taco. I don't think it'll happen with that. Rizal saying, is laser CO2 good treatment for acne scars? How many treatments to do? Typically more than laser. Usually I do a few different things. October saying, what's the story behind the before and after? So actually, I should have mentioned a few different things. We actually don't have his first verse with the acne, but we did calm down his acne. Then we ended up with the cure laser. Then we ended up doing a combination acne scar session. That same day, we actually also did micro lipo of his neck area, and we also did some neck tight there to tighten up his skin. He also did buccal fat removal as well, so he has a more chiseled out jawline there from that. And then we also did excision over here. So if you see a few different things all at one time over there. So I think that's partly what you can see right there. Let's see here. How long to see results for spironolactone? Usually about 6 to 8 weeks, typically around that time. Let's see. Carlos saying, can I do Belafil if I have acne? Yeah, you could. That's not a bad process actually to do Belafil there. Is darkness between legs a scar, and can it be treated? Yeah, you could actually, why don't you try with Eucerin's anti-pigment cream? That's a good way of doing it there. Will a cure laser work if acne is hormonal? Yes, but it does take a long time. So usually you want to do something as a bridge. You want to do some sort of topical antibiotic, something like Dapsone, clindamycin. Those are good options. And then you could potentially try to do spironolactone, usually for like 6 or 9 months, and that could help out with that. Let me see something here. My light just got knocked out there. I know I missed a bunch of questions, so I'm going to get to those in just a few moments as well. Let me just get this thing back to... Otherwise, my room is super dark in here. Oh, now it's too bright. Let's try to lower that. Okay. There we go. So now you know I'm real. I'm here. It's too bright, though. Let's try to lower that there. It's like it's washed out then. Okay, there we go. That's fine, whatever. Okay, there we go. Sorry, I missed a bunch of questions there. I had to do that. Let me fix this here, though. Where was I here? I'm going to try to wrap things up very fast. What is the best treatment plan for boxcar scars? Boxcar scars, usually the best things to do is a little bit of laser around the edges, and then Belafil works out really well as well. So Belafil is a great option there as well. It just depends. Neela saying the hypopigmentation that she has is improving, but still there. How long does it take to completely go away? Sometimes 4 to 6 months. But there's ways to improve it a little bit faster. So let's talk a little bit about that for however you got for the hypopigmentation areas. We could be able to see if we could help you out even further with that to improve that. I am working a lot more with hypopigmentation for next year as well, guys. You guys know that I've been talking about that. I'll showcase a lot more with hypopigmentation because it's just been a problem for a lot of patients for scars as well. So I'll showcase that with the excimer laser as well, and then we'll showcase some other aspects with it as well. Thoughts on keloid scar revisions, why no one does any research on keloids. I appreciate that, Nazops. It's actually, I do 5FU, Kenalog works incredibly well as XLV works incredibly well. I will say it's on my radar for things that I want to really push and really try to really make sure that we could showcase, not just showcase, but also do other types of treatment options there for people. We do excisions in the earlobe, for example, but sometimes on the skin, it doesn't necessarily work as well, it doesn't heal as well. But it depends. If you're wearing silicone tape afterwards, it's possible that it could be an idea for you. But that being, that the only thing is that it's a very complicated case, typically with keloids, and it's very, very painful for patients. So I'm aware of that, and something that I'm going to try to push a lot more to kind of showcase for people too. So let's see here. I'm going to finish up a couple things here. Bo Kimmy saying, can you prescribe medicine to patients if they still struggle with hormonal acne? Absolutely, I could. Let's see here. Versa saying, I got a horrible punch excision from an acne scar and it looks worse. They did it under the skin stitches and there's still hard scar tissue underneath that won't get better with laser. Well, you could do a steroid injection for that. First of all, sorry that happened. Sometimes it's possible with excision that could happen. But that being said, you could do a steroid shot sometimes. That could end up helping out with that. So that may be what you need to relax at there. And really, when you do excisions, when I'm doing it, I'm trying to make sure that's across certain lines so that there's less tension in the skin as we do it. So that's something that some people, surprisingly, even plastic surgeons, people that do a ton of excisions, they sometimes I see it, and I've worked on patients that have done it elsewhere, and it was not done on the Langer's lines that they really should have been doing. Let's see. I know I have so many questions, so I love it, but I know I missed some of those there. So I hope I could be able to answer everybody's here. You got results from punch excision. So this is a patient actually right here with punch excision as well. That deep scar that you see in his lower part of his cheek, that is with actually punch excision right there. Let's see here. During the virtual consultation, are you able to provide an estimate for treatment costs? Well, I'll break it down and then I'll actually have someone explain it then to you afterwards. Pitted scars for African American skin. I actually showed that last week, but I'll be happy to show that again later on. If there's a code blue on the plane, are you getting up to help? Of course, yeah, absolutely, I would. My background is actually with internal medicine, and so I did a lot with codes. I've saved dozens and dozens of lives, and some lives I couldn't save. But it's like I will absolutely, my sister actually, she was found down in a restaurant. And in a hallway, she was just at a restroom and was just found down there. And if someone had caught her and did CPR there, she would have been alive. So it sucks. So absolutely, yeah, I would absolutely do that. It's just it's terrible. It's like it's terrible that people don't know CPR. It's not taught really properly well. The person who found my sister, they called for help, which is good. But really, there was a delay, though. Really, it's every single second counts, and so it was like several minutes went past, and then she died. So it was unbelievably terrible. It was just shocking. And my dad was actually there, and he's a cardiologist actually, and he didn't know about it because he was actually he wasn't near that area. And then he went over there, and he was doing CPR. Well, nobody else was doing CPR. He's in his late 70s. But it did effectively, but still it's, when they came in and checked the rhythm, it was something that was a shockable rhythm too. It was something that you could shock out, and so it was, and so it was like VTAC, and I've actually saved, dozens of people in VTAC before. So it was terrible, it was a terrible situation because I was like, and then my dad called me, he's like, she's in VTAC. I was like, okay, well, that's shockable. That's doable. That, we could save that. But no, it didn't happen. And it's because, you need circulation to your brain. So it's like CPR, like honestly, it's like one of the major things. Everybody should learn CPR, everybody. And I appreciate you guys for the condolences, by the way. I appreciate you. But like, just like, that is like something I do want people to know well. Just like learn CPR and you can save a life. You never know when. And it's going to be amazing. If it ever happens, like where like that one moment, that one chance that like you did it and like because you learned how to do CPR and like how to do it effectively, so that's that'll be pretty amazing. Like you would have that for the rest of your life. Honestly, like I felt like I've saved a lot of people's lives, but like honestly, like during COVID time, it was like 13 to 16 codes every single day. So it's like you're going running around code blue and like you're doing intubations, all sorts of stuff. And I was actually at my clinic, but we had to shut down for a few months. So I went to New York City actually during that time, and I worked in COVID there. And it was like, it was wild actually. And I was like, we were basically triaging, people that were in their, 40s, we take preference over somebody that's in their 60s. And that's terrible. It's absolutely terrible. But like, so it stays with you, honestly. When you do CPR, it's like, but like I did save some people, but like there's other people that like in their 60s that, it's like, it's terrible that that like we just didn't have the resources and nobody understood that. And to this day, it's like everybody acts like, it didn't happen, nothing happened, all that stuff. And it's like, I understand the whole politics of it, that like they shouldn't have shut down as much as they did. I'm not even saying that, but like the thing is, it really did, like it was crazy in New York City. It was really crazy. It was terrible. So it's like, I don't think anybody should, have to go through that process, and like nobody should like really downplay the how important it is to save someone's life. So just learn CPR, and I appreciate you guys all about that. Aber's saying that my 3-year-old daughter was found at the bottom of a pool, although people who had taken CPR were too scared to attempt. My husband did it, but honestly didn't. I'm so sorry. I'm sorry that happened, Aber. I'm really sorry about that. Honestly, it's a small little club, right, of people that go through that, and it's not fun. But anyways, that being said, this was my end for tonight, though. I ended on a more difficult topic there, but also I thought it was just more important, honestly. Someone brought up CPR, so I just want to let people know it really is like the thing, like the difference between like that little like minute. Sometimes it's just that's it. That's the difference, between like perfusion in the brain and no perfusion in the brain. So just so you guys know, just like save someone's life. I appreciate you guys. Appreciate all of you. Someone was asking if you need to massage the area if you do belly flow. Not really. No, not really. I typically don't do it that way. Joey said that he did a CPR course over a couple of weekends. That's awesome that you did that. And I'll finish up here. Can cortisone shot be used on a small, slightly raised hypertrophic scar? Yes, it could be, slightly. And everyone else, thank you guys so much. I love your this community, honestly. Thank you guys so much for all the condolences. Appreciate you. And I'm again sorry, about what happened to your granddaughter. I'm really sorry about that. Wonderlost, same thoughts. You know what? I'm going to talk a little bit about that tomorrow. So I'll hit up everything else tomorrow for any other further questions. I had a bunch of questions, still some more salicylic acid, a few other things. So I'll hit all that tomorrow, guys.